There are three things that we think every parent should know about antibiotics. Number one, first and foremost, they save lives. They have been a great introduction and invention in modern medicine to save lives. So we will not diminish that, and we will not say that that does not exist, nor are we anti-antibiotics in all circumstances and in all cases. Number two, we do believe that they are often overutilized. If we look at childhood ear infections as an example of that, studies show that 80 to 90% of all childhood ear infections are what they call self-limiting, meaning that they can go away and often will and should go away on their own naturally and normally. In fact, the American Medical Association has actually released to pediatricians some interesting findings. In fact, the clinical guidelines for a child with ear infections is a 3-day wait and see period, which basically just means if you suspect a child has an ear infection, pediatricians are supposed to wait and see what it's going to do before prescribing the antibiotics. Number three, they have consequences. Just like any medication and just really anything that you do in life, every action has an equal or opposite reaction, or every choice that we make has a consequence. Same thing with antibiotics. In fact, studies show that antibiotic exposure to a child in their first year of life are associated with things like autoimmune diseases later on, allergies, asthma, ADHD, and even autism has been correlated to early exposure to antibiotics. And I know I said three, but I'm going to give you a bonus one because I feel like it needs to be said, even though it just seems to be maybe common sense, but it may not be that common anymore. The fourth thing is antibiotics don't discriminate. They don't prioritize. They aren't intelligent enough to know which bacteria that they should attack. We actually have more bacteria on and in us than we do human cells. And antibiotics will come in and not discriminate or not be able to isolate specifically the bad and the good bacteria. So it just comes in and wipes out everything, which is why we see it linked to chronic conditions later on, because we need that good bacteria to be healthy. And again, we're going to say this, and we'll say this over and over again. We're not here to wage war against antibiotics. We're not here to speak ill against them. We are here because we believe informed parents make better decisions, and these are things you need to be thinking about as you make choices for the care of your kids. And finally, if you found this informative or helpful in any way, please subscribe to our channel. We are going to be releasing more content like this on a regular basis, and we would love for you to be engaged and get that information so that you can help optimize your family's health by making better decisions, so that you can optimize your family's health as they move forward in growth and development. Thanks so much. Look forward to talking to you soon. Hope is straight ahead.